About all of this now with Graham Stringer. He's Labour MP for Blakely and Broughton, one of the 5 MPs in Greater Manchester who told the government they cannot support the mass closure of hospitality venues as part of new lockdown measures. Good morning to you, Graham.
Good morning.
Good morning. Again and again, people on the backbenches, the public, journalists, everyone has said, can we please have the scientific evidence that, say 10 p.m. curfews make sense, or indeed closure of pubs and restaurants makes sense in terms of stopping the spread of this virus. And again, we've not been given any clear evidence of that case. Is that why you and other MPs in the area are concerned that these are going to be measures that will drastically affect businesses and jobs, but may not have any effect on the spread of the virus?
Precisely. I mean, there are other reasons. The government has been over-centralised and has taken arbitrary decisions. I'm a member of the Science and Technology Committee, and we have regularly asked for the scientific basis for a number of decisions that the government have made, and they've failed to come up with it. There is obviously a serious problem, and the government seems to be saying we've got to do something. This is something, therefore we will do it. But the other side of it is some of our economies may never recover. There are a lot of jobs in catering and hospitality, and even if people are paid a decent amount, if they're sent home, the businesses might not be there at the end of this. They might not have jobs to go back
Well,
to.
this is it. A lot of people seem to think, again, these are temporary measures. It only affects a certain small sector. This is a huge sector in our economy and in many of these cities. B, when people aren't going out to eat in a restaurant or go to a bar, they're not going out to work, they're working from home. They also don't go to the shops. They don't go to this. There are loads of things. The taxi drivers lose business. The knock-on ripple effects of these decisions are huge. And any of the help that Rishi Sunak announced on Friday for people whose businesses are legally required to close, well, that help isn't going to be available for all the other people and other businesses who are going to be affected by the knock-on ripple economic effects.
Precisely. I guess I'm like most other members of parliament. My inbox is full of emails saying, I have spent a lifetime building up this business. I can no longer sustain it. And they're often employing 5, 10, 20 people. Small and medium-sized breweries are finding it very difficult. They've had virtually no help. But the other side, not just the people selling beer and alcohol in pubs, the people manufacturing it. If the alcohol isn't being sold, then the breweries are in trouble.
Yeah.
There is a whole chain of employment that is affected by this, and it's difficult to see how parts of the economy will recover if the government carry on with these policies.
How is it sustainable, though, and again, the responsibility lies with the Conservative government, no question at all. They're making these decisions. They have to hold their hands up and take responsibility. And it's very easy to be in opposition at these times. But how is it sustainable for the Labour leader, Keir Starmer, to say, we support any measure? He said this himself. We support any measure that the government brings in. And then to say, what is the scientific backing for, say, a 10 p.m. curfew? And then not be given any actual evidence, and then to continue to support it. At some point, does the Labour Party not have to stand up for workers, for jobs, for business, and for a policy being made based on science and medical evidence? And when are they planning to do that?
Well, yes is the answer to that. I'm not sure when they're going to do it. Keir Starmer took a very sensible decision in March that this was a crisis and he wouldn't play party politics. He would support the government. Since then, the government have behaved pretty appallingly and incompetently in this. And I think the time has now gone where we should be supporting anything and everything the government do by abstaining. I voted against the government keeping the powers that they had under the Coronavirus Act. I think now we should be very critical because the government have made a mess of it. Just in terms of expenditure that hasn't been good. I worked out the other day, in 6 months they've spent about 1.5 times what we spend on a year in the National Health Service and have destroyed jobs. And many people have died who wouldn't otherwise have died if they hadn't have been sent back into care homes. We can't continue continue to support policies that are bad policies just because there is a crisis. So I agree with the fundamental point you make. There's a real contradiction between criticising what the government is doing and then abstaining.
What is the alternative, though? Because I'm sure when you vote against these measures, there'll be people get in touch with you, as they do with me, and say you're going to be responsible for killing people. Matt Hancock, the health secretary's cry, we're all going to be killing Granny. There are alternatives to this, though. What are you proposing as an alternative?
Most of the emails I've had have in fact, all of them, very unusually, have said, thank you for standing up to this government. They're making a mess of it. The alternative, which is a really good question, is that we need to get rid of the centralised system. The whole history of public health in this country has been for local authorities to basically whatever was the equivalent of test and trace in the 19th and early 20th century to deal with things locally. The centralised system has been badly administered, but it is very difficult. If you give out a contract to a private company, it has certain parameters, certain things they can and can't do. If you need to respond to a local outbreak, then you need to be really fast on your feet, and centrally they're not. So the power needs to be handed over to the public health authorities at a local level.
And just finally, the opinion polls suggest that 7 out of 10 people support local lockdowns, even in their own local area. 6 out of 10 want to ban all international travel. 5 out of 10 people would support another national lockdown. At the same time, more than 8 out of 10 people, according to a poll from the Mirror, say that workers fear job cuts. That people seem to be very fearful of the virus and very fearful of the economic effects. But why do you think so many people are so in support of local lockdowns, which they now know will cost jobs and will cost the economy, and the evidence suggests won't necessarily save lives?
I think the reason for that, most of the people I talk to are worried. They're worried about the disease. They're worried about their jobs. But they say, we don't understand what the rules have been. We're going to carry on doing what we're doing. We want to be as safe as we can. And I think, but we don't respect the government anymore. But when they're asked in opinion polls, it's asking them to be virtuous, isn't it? Yeah. They want to save people, so they say, yes, we'll do things that will save people. But actually, we won't be following that because we see it as irrational or nonsensical.
Very interesting. Thank you very much indeed. Graham Stringer, Labour MP for Blakely and Broughton, one of the 5 MPs in Greater Manchester who've told the government they won't support a mass closure of hospitality venues. Boris Johnson's statement later on today, press announcement at 6 o'clock in the evening for us all to watch on the TV about these new 3 tiers of local lockdowns. Now, it's expected that Liverpool may be the first city to enter the tier 3 restrictions, which, for all intents and purposes, other than going to work and school, is a full lockdown. Well, the Mayor of Liverpool, Joe Anderson, joins me right now. Good morning to you.
Good morning.
There's a lot of confusion here. Is Liverpool? We know there's been a lot of negotiation going on between Number 10 and the various leaders of the great cities of the north of this country, trying to debate what measures should be appropriate and should be brought in. But will Liverpool accept these measures? Because the Mayor of Liverpool City Region, Steve Rotherham, has said that he has made it clear that he does not want to have these sort of tier 3 measures, and that he says he's asked for evidence and it's not been forthcoming. But the implication is that you, as the Mayor of Liverpool City, that you do want these measures. Which way round is it?
Well, Steve Rotherham and myself and the other leaders of the City Region were in discussions with the government all over the weekend, Friday, Saturday and yesterday. And we've agreed a number of things. But, one of the things that we've made loud and clear is that we want support for our businesses here and the impact on them. And also, we have asked for the evidence of why they have a blanket approach. Let me be absolutely clear. I resisted and refused to accept the closure of restaurants. I said a lot of them have been made COVID safe. A lot of businesses have spent money making themselves COVID safe. And I thought it was madness to actually close restaurants completely, totally. And equally similar to some pubs, the government just refused to entertain that idea at all and had made up their mind that this was going to happen. So, when Steve talks about not accepting it. We don't accept their arguments. We don't accept that in the way they are approaching this, a blanket approach that's the right thing to do.
But you would be willing to accept pubs closing?
Well, we've got no choice, have we? That's the point I was just going to make. We've got no choice. The governments are the governments, and if they legislate, which they are going to do, put the orders before Parliament today, debate and discuss them. My argument my point to all the North West MPs is to challenge and resist and demand, a proper full compensation package of furlough to all businesses affected. If we're not able to stop this, and this is my point that I as Mayor of Liverpool or Steve Rotherham or the other leaders across Liverpool City region, we can't stop the government enacting parliamentary measures that put our city in, probably 75% lockdown. And that's a fact. It simply is that. So what we've tried to do, what I've done, is put forward proposals to help us deal better with track and trace. And that's what we're doing. They're working with the army personnel, back office army personnel that are in the city this morning as we speak, arriving in the city to work with us, our public health officials, to do a better track and trace system, to try and target measures of bringing the virus down. We ask for more resources to do that. We've been granted more resources to do that. We asked for more powers, enforcement powers. We're being given those enforcement powers. But unfortunately, in relation to the furlough scheme, asking for a fuller compensation like the national one we had in March, that was rejected. And also the blanket approach to closing restaurants and bars was rejected. And as I said, there's very little we can do about it, but we argued the case.
Are you planning to join with the Greater Manchester Mayor Andy Burnham and his nighttime economy advisor Sacha Lord? We're going to speak to you later in the show, who started legal proceedings challenging the government, basically arguing they haven't got the scientific evidence to do this and they can't impose emergency legislation without scientific backing.
Absolutely, we will. And I'll be talking to businesses later on today in Liverpool to look at exactly what they can do. Look, this is going to be a devastating blow to the economy here, the hospitality economy. I spoke yesterday and said that, it's potentially can damage us in the same way the 80s damaged us. If we're many of these businesses are absolutely now struggling. We've lost 206 businesses in the hospitality sector in the last 4 months because of COVID. And many more of them are going to go to the wall and not return. And that is going to damage the local economy, and it's going to also damage the national economy. So it's absolutely vital that it's challenged and we look at it again, because it's just a sledgehammer really to crack a nut.
Can I ask you, why do you believe that the cases are still going up in Liverpool? What's your best explanation, and what do you think the solution should be?
It's not a best explanation. It's a fact. If you look at we returned to work. Everybody returned to work after the summer. Schools went back in September. Universities have opened again, and 20,000 students returned into the city. Schools, as I said, have opened, and that community mix. That means that living cheek by jowl, 70% of our houses are terraced houses, where we've got a population of 500,000 people. It means that the human contact widens and gets more, and therefore the virus which spreads on human contact is able to increase. It's not rocket science or something that should shock us. If you take the students out of it, and you take, the fact that we expected a rise, a spike in numbers because of schools, if you take those figures out, it's probably, nowhere near as bad as it looks. However, it is a real concern and worry, and we all agree that we've got to try to bring the numbers down, because I'm concerned about the hospitals here in Liverpool being overwhelmed.
Why would they be overwhelmed? They weren't overwhelmed back in March and April when we reached the peak. Why would they be overwhelmed now?
because we're heading to a winter period where we know that people are going to pick up other viruses.
We've got the Nightingale hospitals; they can go back
in Manchester. In Manchester, they've got the Nightingale Hospital. In Liverpool, we've got the wards that we've set aside for COVID are 2/3 full. We've got 3,000 people in Liverpool infected at the moment, and that's going up by 700 a week. So if you're telling me to calm down and not worry about that, well, I'm sorry, I won't, because I am worried about it.
Not saying calm down, not worry about that, but it's about proportionate response, isn't it? I mean, no one sensible is saying, don't worry about it. Oh, a few people today. No one sane and sensible is saying that. It's about a rational, proportionate response to the threat.
And that's exactly what we're calling for. And that's why, a blanket approach, closing restaurants down, which restaurants are probably the safest, venues around. We're closing gyms down when you can't go to a gym unless you're ready to, go in the gym. And then as you come out, and the safe distances within gyms, and then as you come out, the equipment's cleaned. We're closing them down. It just seems to me that this is more about Boris Johnson being able to show that he's reacting and how macho the government is, rather than a common sense approach to this, because some of those businesses are operating in a safe way.
Okay, thank you very much for joining us. Really appreciate that. Mayor of Liverpool, Joe Anderson. Right now, going to turn to Jim McMahon. He's Labour's Shadow Transport Secretary. He's also MP for Oldham, West and Royton, which is part, of course, of Greater Manchester. Good morning to you, Jim.
Good morning.
Good morning. Lots of talk today about what these three different tiers, medium risk, high risk and very high risk, could mean. We know Liverpool very likely to go to the very high risk section, possibly Greater Manchester as well. I mean, to all intents and purposes, a full lockdown other than kids going to school and people still going to workplaces. Will the Labour Party, will you support these measures going ahead?
What we've said is that we need to see the evidence base that supports the interventions, because whatever we do, it will have an economic impact, both in terms of the businesses, our regional economies, and also individuals. And so that has to be supported by the evidence base that says that intervention is targeted and it's the right thing to do to reduce the spread of the virus. We then need to make sure that there's a proper package of support in place to make sure that people are supported through what could be a very difficult period economically, to come out the other side in a healthy position. And then we need to make sure that there is it's time limited, that we know what the end is. We know what the measure will be to allow areas to come out of intervention. And then, of course, clear messaging and communication. And so what we're saying to government is the onus is on them to make sure that they produce the evidence, that it can be tested, and then we can match that against interventions that are being proposed.
And if you don't get to see that evidence, let's leave the economic support aside, because the first point is, if there's no evidence for it, you don't want it to happen at all. If you don't get to see the evidence, will you allow it to go ahead, given that there are enough Tory rebel MPs who could, with Labour, could defeat these measures if they came to a vote? Because Keir Starmer last week in Prime Minister's Questions asked the Prime Minister for evidence of the 10 p.m. curfew. He was given none whatsoever about it would save lives, and most people actually, any sense, think it will actually cost lives, with people basically drinking late night at home without social distancing rather than in a pub or a club. And then he went on to support the measure without the scientific basis. If you don't get the evidence, will you support those measures going ahead?
The practical difficulty we've got, I suppose, is more about how Parliament works. So when the vote will be taken, it will be a package of measures that will introduce local restrictions far beyond, say, the 10 p.m. curfew that I know a lot of the Conservatives are concerned about. And by the way, you can see why, given the scenes that we see on TV, seeing the newspaper reports of what it means when people bottleneck outside venues at 10 o'clock. But there is a wider package in place. And so what we recognise is that the government do have to take action to reduce the spread of the virus, and that does require intervention. Now, there's a difference between supporting it, and we are usually inclined to overtly support measures that reduce the spread of the virus.
We're not inclined to. Keir Starmer has said we support any measures the government introduces. That's what he said.
Well, the assumption there is that the measures that have been introduced are proportionate and evidence-based. Big
assumption, isn't it?
Well, it's not an unfair assumption. That's how government should
But
work.
hold on a minute. We've already established that the 10 p.m. curfew, there's no sign. We haven't been given the scientific evidence for that. There's plenty of evidence it's actually doing more harm than good, and yet the Labour opposition has allowed the government to continue with this. You're having it both sides. You're having your cake and eating it, aren't you? You're going, oh, we don't really like this. We think this is terrible, and then you're supporting it happening.
No, what we are trying to do, and we're desperately trying to do this, by the way, and I'm sure it doesn't come across, but there's a real anger in the north of England about the way that we have been treated, about the way the confused messages have been instilled. And by the way, we talk about a new tier of intervention coming forward. But bear in mind that Oldham has been in social lockdown now for 7 weeks. It means we can't use public transport for anything other than an essential journey. It means we have 10 fewer mourners at a funeral. It means that we can't meet with our friends and family outdoors in any setting, and that includes the local park. So we have been living this now in Oldham for 7
So why are you
weeks.
still supporting those government measures then?
It's not about supporting the government measures, it's about holding the government to account, testing the evidence base and making sure that the financial package is in place to make sure that the communities who are affected by restrictions are supported. But none of
Okay,
us,
wait a minute. In 7 weeks, has the virus rate gone down in Oldham? In 7 weeks of those restrictions, has it gone down?
No, they've gone up
No, it
significantly.
hasn't. So why are you still supporting
Absolutely.
those measures? It's not science-based. There's no evidence it's actually working. Why is the Labour Party still supporting measures that this government is bringing in which are not based on the science?
Well, there's one thing that's absolutely guaranteed, which is if we don't do something, the infection rate will continue.
So we have to do something. So do
increase.
something.
So you've got to have
So you're
measures
going to
in place.
support anything. You can have measures in place,
Absolutely.
but doing something. Okay, well, let's all set a load of hot air balloons up in the sky. That's doing something, but it won't make a darn bit of difference to whether anyone dies of COVID, was it? Why is the Labour Party still supporting measures for which there is no scientific evidence that they work and have not, in 7 weeks in Oldham, in your own constituency, been shown to actually reduce the spread of the virus?
Well, at the moment, the measures that are being proposed as part of the 3 tiers that the government have been briefing over the weekend aren't the same as the measures in Oldham. I think it's pretty clear that very few transmissions were taking place in funerals, and so there's no evidence base at all to reduce the number of mourners down to 10. There's very little evidence that it was taking place even on public transport. So why restrict Oldham when the rest of Greater Manchester wasn't restricted? And listen, this has been very imperfect, to put it mildly. What we need to do as an opposition is to make sure that we're giving a voice to the people who are affected by the decisions the government are making.
You've got a voice. You can vote in Parliament against it. Labour Party could vote against these measures. With the Tory rebels, you could defeat these measures and then insist that the government provides science-based evidence for measures that might actually save lives. Why don't you do it? You want to have your cake and eat it and just say, oh, this is terrible, isn't it awful, horrible Tory government, and then wash your hands of any responsibility. You're an elected member of Parliament. Why don't you do something to protect the businesses and the jobs and the lives of the people in your constituency?
With respect, I've been rolling my sleeves up. I spent all of summer door knocking with public health officials and district nurses, doing swab tests on the door, doing business-to-business tests. Every week, I am absolutely swamped with correspondence from local people, trying to give people the on-the-ground support that they need through these times. Every part of my diary, every day of the week, is spent on meetings with the local council, with the Greater Manchester Mayor, with government officials and the rest of it. We are putting the work in to give our community a voice and try and find our way through this. But it's for the government to come forward now with the evidence base, the financial support, and the very clear messaging. And it's our job to hold them to account on that. But we cannot have a situation where you have an infection rate going through the roof in the way that it is without any interventions. And so, although there will be a package and there'll be elements of that we are uncomfortable with, and the 10 p.m. curfew is a good example of that, but the idea that you block any restrictions coming into place at all when the infection rate is growing at the rate it is, I'm afraid it's just not a credible position.
But again, no one is suggesting that, which is why it's not a credible position. Jim McMahon, Labour's Shadow Transport Secretary, MP for Oldham West and Royton, of course, part of Greater Manchester. Very much appreciate you joining.